Can you talk a little bit about how mental health can impact your sex life?
Mental health is a huge impact. So one, I always say, like, is it the sexual health that created the mental health or the mental health that created the sexual health problem? Because sometimes you dig deep and you find out that the reason they're having mental health problems is because of some deficiency they're having in their sex life. So that's one possible thing, but they're very commonly commingled. So when you look at like people with depression, anxiety, or taking meds for depression or anxiety, about 30 to 60% of those people will have sexual dysfunction. So it's very, very common. And some of it's because of the medications. So
Sexual dysfunction is defined as what?
it could be a variety of things. It very commonly could be low libido. It could be difficulties with erections, ejaculation, arousal, any of those categories you could have problems with, orgasms even, depending on, what the issue is. But also those medications, SSRIs particularly, have high rates of sexual side effects. And so they're dose dependent. So some people on low doses won't experience them, but some people on higher doses will. And it can be really difficult because they need those medications to feel good, but then they can't have, they're maybe having trouble with desire, which is probably the most common thing we'll see. But also think about it. If you're not feeling good about yourself for whatever reason, it's very difficult to allow yourself to experience pleasure and enjoy pleasure because you're feeling bad all the time. And that's the same thing about stress, right? If you're really stressed all the time, it's extremely difficult to allow yourself to experience pleasure because that's just taking over. All that cortisol and those negative feelings are taking over your body, and you can't relax enough to enjoy pleasure.
That's true, because I do see a direct connection between periods of my life where I'm super stressed out and a complete lack of a sex drive. And if you think about stress as you being in a state of fight or flight all the time, it's kind of hard to drop in and be present, which is one of the big things you have been telling us today. You got to look at it as play, and you got to figure out how to be present. Otherwise, you're not going to enjoy it as much as you could.
Yeah. In fact, they've looked at people who have mindfulness practices, and they found that people who maintain mindfulness practices for like 8 weeks, for example, are more likely to score better on like sexual function indexes. So they're actually having better, more satisfied sex, and, scoring better in a whole bunch of different domains, particularly desire being one of them. And so, it's part of like, again, mindfulness is going to help us be present, not just in sex, but in a whole variety of things. But our society is so busy right now. Everyone's like, how can I get mindfulness in? And what I tell people is like, just start with a minute or 2 minutes a day where you're dedicating some time to yourself and you're trying to be mindful. And then you can build up a mindfulness practice. It may benefit you, and it's free. It's completely free. Like, try it and see. The only thing you're giving is time, but you're giving that time to yourself. You're giving that time to improving yourself.
Dr. Rena, can you talk a little bit about how somebody who has experienced trauma can reclaim their sexual health?
Yeah, so trauma is very challenging. And I think it takes, if you've experienced trauma, I strongly suggest you see a mental health professional, because there's going to be a lot of layers there that you need to kind of work through to really, be sure that you're sort of feeling safe. That's the most important thing, is you have to feel safe. And I can't teach you how to feel safe. You have to work on the thoughts around your trauma and be able to sort of navigate those through whether cognitive behavioral therapy or other things that they can offer you to sort of be able to feel safe. Because if you don't feel safe because of your past trauma, you're never going to be able to have good sex.
I read that men who ejaculate 21 times a month lower their risk for prostate cancer. Is that true?
Yeah. So there was one study that looked at this. It was a very well done study, and they basically followed men for almost 20 years. Okay. They followed like 40,000 men for 20 years, and they looked at their numbers of ejaculation per month. And they basically categorized them 1 to 3, 4 to 7, on and on and on. Right. And so they had these categories. And what they found was that men who ejaculated 21 times or more a month were a third less likely to develop cancer, prostate cancer specifically, in that time frame, compared to men who ejaculate only 4 to 7 times a month. And they did a pretty good job of trying to control for other variables like other, health conditions, smoking, dietary factors. So it was a really well done study. Now, does that mean that you need to ejaculate 21 times or more a month? No, not necessarily. I think it's really, who's ejaculating 21 times? They're having either really great sex, they have a great partner, they have a good social relationship, they're very comfortable with themselves, maybe they're healthy enough to ejaculate 21 times a month. So there's some variables that you just can't control for. And so I think ultimately it's, again, goes back to why sexual health is health. If you're able to ejaculate 21 times or more a month, like, yeah, you might be cleaning the pipes and you might be getting rid of some free radicals or things that would lead to cancer. So that's not a bad thing necessarily, but ultimately it's probably an indicator that you're healthier.
Is there any corresponding study around women ejaculating more and it improving our health?
Not yet. Not yet. But we know there's so many benefits to orgasm, right? You have decreased blood pressure, your mood is better, you're getting better sleep with orgasm. So I anticipate the findings would be similar, right? Because these things are very difficult to study. We know good sleep is important for a variety of health factors, right? So sleep is important. We know having lower blood pressure is important. So all these things, you're probably like a healthier person if you're having more orgasms because you're having all these benefits of orgasm.
How can a guy's masturbation technique impact their sex life?
Yeah, so I never like to shame people for masturbation. I think that, masturbation is a healthy form of self-exploration, and it's rare that it becomes a problem. But certainly there are certain types of masturbation that have been correlated with having more difficulties with erections. Now, that can be prone masturbation, meaning lying on your stomach and masturbating, like towards like maybe hitting the bed or other hard surfaces.
And like hitting your penis on the bed?
Mm-hmm,
okay.
Yeah. So that,
I was just saying it like if you saw me at you, if you're watching, if you're listening, you didn't see my facial expression on YouTube because my face scrunched. I'm like, masturbating as you're laying on bed? That makes, I get it. Okay.
Yeah. Yeah. And then also they call it, death grip, or having a very firm grip on the erection can put you at higher risk. Now, does it mean that everyone who does these things is going to have problems? No, not necessarily. But ultimately, if you start noticing that, and the reason they have problems, right, is because say you get used to, and women can get habituated to certain types of masturbation too. We just don't have the data on that, right? If you're doing the same thing every single time when you masturbate, and you can't replicate that with a partner, right? Either through vaginal or oral sex, then you're not going to get the stimulation you need to climax because your body's habituated to that one thing, right? And so that's sort of like where you're like, okay, I need to keep variety in my life when I'm masturbating. Like they found that using lubricant for men actually helps. So, or is correlated with less issues. So using lubricant or like making sure it's just not a very firm grip. And so that's what I usually tell people if they're having trouble and they're masturbating a certain way and they think that might be the culprit, is just stop for a little while. Stop masturbating for a little while. And then when you resume, start masturbating with, different sort of lighter techniques and different positions potentially, and see if like you can sort of train yourself to enjoy different types of stimulation.
Is it normal, Dr. Rena, for somebody who was once vibrant, no issues, to suddenly have problems getting an erection?
It's actually very common. It's very common. So 52% of men over 50 will have issues with erectile function. And that just keeps increasing. So 60% of 60-year-olds, 70% of 70-year-olds, 80% of 80-year-olds. And, it's more common in people because of vascular issues. So we know there's lots of people with high blood pressure, diabetes, high cholesterol, and these can all affect blood flow to the penis. So what I tell people is the blood flow to the penis, the arteries to the penis are about 1 to 2 millimeters, whereas the arteries to the heart are about 3 to 4 millimeters. So before you see problems in your heart, like chest pain, you're going to see problems with your erections. And so if you have troubles with erections, please see your primary care doctor to get evaluated because you want to make sure you don't have an underlying health issue. So I will usually screen my patients with hemoglobin A1C, like to check their blood sugars. I will screen their cholesterol. And I can't tell you the number of times I found high cholesterol or, maybe pre-diabetes in a man who has erectile dysfunction.
So erectile dysfunction is like a symptom that there may be developing heart issues.
It could be a sign, yeah.
Wow.
Yeah.
And what are the treatments available?
So there's lots of treatments available. There's other types of causes of ED too. I want to make sure we don't.
Let's talk about them.
Yeah, there's psychogenic ED. So that can be like some of the things we've talked about where performance anxiety becomes an issue, right? You're stressed about, say you have one episode where you have an erection that is lackluster, or maybe you don't get one, right? Maybe you drank too much. Maybe something happened that day. You were stressed. You couldn't get an erection. And then you're stressed about it, right? And then you think about it, you ruminate paranoid about it. The next time you have sex, you're like, am I going to have an erection? You're in your head, right? You're thinking that. And then you you don't get one because you're so stressed, right? You're impossible to relax and enjoy. And then you're again, not having an erection. And then it just cycles into this horrible, vicious cycle. And I tell people, everyone who has issues with sexual function has some psychogenic component, right? Because you're like always thinking like, I'm like, even for women, am I going to climax? Is it going to happen? Am I going to have an orgasm? Is it going to be okay? Am I going to squirt? Am I going to squirt? Right? Like all these things, sort of, they stress you out. And so everyone has a little bit of that for sure, but there's some people where that's the only cause, right? So that's one thing. There's hormonal causes, so lack of testosterone.
How do you know if a man in your life is struggling with low testosterone?
So the symptoms can be variable. So people always think about erectile dysfunction as one. That is one, but there are others. It can be low libido. That's a very hallmark symptom. Brain fog, feeling depressed or down, having difficulty getting muscle mass. So say you've been doing this, this routine at the gym and you're like, man, my muscles are just not growing like they used to. That is another sign as well. So these are sort of all signs. And fatigue also, like really significant fatigue can be related to low testosterone.
And what are 3 ways to naturally boost testosterone?
Yeah. So number 1 is sleep. So people really underestimate sleep, but there's actually very good quality studies that say sleeping more than 7 hours and good quality sleep, meaning you're not waking up, you're not having too much caffeine prior to bed or alcohol that may disrupt your sleep quality. Even if you don't really notice it, it does. And then not looking at screens before bed, really like utilizing your circadian rhythm. Those things actually really do significantly improve testosterone. And if you have sleep apnea, treating that will improve your testosterone. So that's 1. 2 is exercise, specifically resistance exercises of the large muscle groups. So like deadlifts, squats, those sorts of like lower body extremities, working on exercise for that. And then, diet. So people think, actually a low-fat diet is actually harmful for testosterone because it's made from cholesterol. So you need some fat in your diet, so healthy fats. The best studied diet is the Mediterranean diet, which is lots of vegetables, lots of fruit, using healthy oils like olive oil, avocado oil, and then, mostly lean meats and protein, and then a little bit of red meat is fine. But generally, whole, unprocessed foods are going to give you the most benefit.
So you said that some of the treatments for erectile dysfunction include trying to boost testosterone, getting a good night's sleep.
Yep.
And is there anything else?
Yeah. So then talking about erectile dysfunction specifically, there's medications. They're in a class called PDE5 inhibitors, and they essentially work by increasing blood flow to the area. So they sort of relax the vessels. They allow what's called nitric oxide and the cascade of events that happen to sort of stick around longer. And so ultimately they're increasing blood flow to the organ, and they work pretty well for a lot of people. About 60 to 70% of people have positive results with these medications. Now, there's different formulations. There's sildenafil, which is brand name Viagra, which is an on-demand, an hour before sex, lasts for up to 4 hours or so.
Oh my God, no.
I mean, your erection's not going to last up to 4 hours, but like, you can take it and then have sex like 3 hours later and it should still be around, right? People always like caution about having an erection that lasts longer than 4 hours. That's very, very, very rare with medications. So like, if you look at the studies, it was like 1 or 2, it was very few number of patients who actually had that problem. So if you're using it as prescribed, it's almost a non-issue. Like it's extremely rare.
That you want them to take away from this conversation.
So one thing I want you to put into action today is to look at yourself in the mirror and say, I am deserving of pleasure. I am entitled to have pleasure by myself, with my partner. And then I want to figure out what that is and be able to communicate it. And take those baby steps, and first with yourself and then with your partner, and allow yourself to be worthy of, what you want, because you deserve it.
Oh, I love that. Thank you, thank you, thank you.
Welcome.
And I want to also thank you for being here with us today and for listening to and watching something that will help you create a better life.